We're here at Connected Health Symposium in Boston with Amy Cueva from Mad Pow. Welcome, Amy.
So good to be here.
Yeah, so tell us a little bit about what you do at Mad Pow.
Sure. So Mad Pow is a design agency, and we focus on improving patient and clinician experiences through human-centered design. So understanding through research what do people really need, envisioning a better experience for them across channels, across the ecosystem of interaction, so that they get the meaning and value that they're looking for out of the products and the services that they're using and the relationships they have. And then also building the digital experiences to bring those experiences to life.
Excellent. So what's the most exciting thing you're talking about with attendees at this conference?
Yeah, I mean, we're really talking about the evolution to designing more human-focused technology, right? It's not about designing a cool gadget or a tool, so moving people beyond shiny object syndrome and focusing on, okay, what do people really need and want? The way the health system is structured, we expect patients to be obedient and adherent and serve us. Well, how do we create a system that serves them and their needs and what's important to them and design it accordingly, because then we're going to get better results. So we're trying to move the thinking toward purpose-driven impact and making a real difference in people's lives.
Interesting. And you mentioned to me that you've kind of shifted from not just human-centered design and patient-centered design, but also business-centered design. Can you talk more about what you mean by that?
Yeah, exactly. So we've seen an evolution happen where technologies have networked, right? IoT, and everything's connected. And that's sort of our expectation now. And we've also seen an evolution happening in terms of social networks. People are connecting more easily, and we've freed that up. Now what we're seeing is businesses starting to connect, collaborate, share services, and form coalitions because they're serving the same patients, but in very different ways. And right now the patient is left at the center of a very disconnected ecosystem. And they don't want 5 apps, an app with their pharma company, their insurance company, their health system, and so on and so on. So what can these companies do together to serve the patient so that they're doing it more effectively? And so we're right now on this territory of not just designing technologies, not just designing services, not even just designing experiences across the system of interaction, but designing business relationships to have that impact focus.
Interesting. I met yesterday this chatbot company where they're using chatbots to engage patients. And as I was talking through it with them, I was like, oh, there's this company and this company you should be working with because you're not going to do what they're doing. You're not going to educate the provider on how to interact once you've decided through your chatbot that this person needs an engagement, so you should use their tools. So, it has to be collaborative because they're not going to do that. They're going to just build the chatbots.
Right, exactly. And that's the evolution that's happening, and it's a wonderful thing because there are so many one-off solutions, but patients are getting fatigued by all of the noise, whether it's apps or communications or people telling them what to do. Again, they want to be served, not to serve, right? And clinicians are also getting fatigued with all of the apps that they need to use. And so the more that we can connect these things, and so instead of creating a one-off solution, creating a service that can integrate with others, finding people who are like-minded and have the same objective, and getting together and saying, what can we accomplish together? So.
And that's really what we need. I think we've seen an explosion of that, though, right? Where they're more willing to work together as opposed to fighting each other to own the entire space. They just want to do individual things, open up the APIs. Now, if we could just get the rest of the healthcare IT world to do it, that would be better. Thanks so much for your time.
Yeah, absolutely. Thanks for having me.